talk about some subjects that are cringy. Urinary tract infections, you get a lot more of them.
Yeah, you do. And that's because we know there are estrogen receptors within the urethra, which is a pipe leading from the bladder to the outside world, within the vulva and the vagina. But we know, as for aesthetics, we know estrogen is very important for like collagen and so forth. But what about down there? You put cream on your face. What about down there? It's meant to survive, like Sahara?
So it turns into the Sahara Desert, does
It does. And I've had some women, I mean, I can tell you tales, but I've had women tell to me it feels like sandpaper between their legs. Feels like a cheese grater between them. That's really sad.
It actually can get to the point where it's painful.
And it can cause bleeding. So you've got women after the menopause who come in to my suspected cancer clinic and they're like, I'm so scared I've got cancer. It's because the delicateness of the skin down below has caused them to bleed. And it's what the thinness of the skin, the atrophy. And this is really easily treated with a bit of vaginal estrogen cream. And it's very low dose that's actually used and very minimal that goes around the rest of your body, to the point where now we can even use it in women who've had breast cancer in the past. Because we know it has such a significant impact in both them feeling that they've got recurrent urine infections, which is not at all comfortable. And we know there's so much health, morbidity, mortality associated. Like women go into hospital because they've got urine infections and it can become overwhelming in their type of infection. And that's why we even recommend estrogen cream for the vagina and around that area for women in their 80s and 90s because we know it has such a significant impact in preventing these episodes of urine infection. And just to stop them from going into hospital because of it.
Okay. So we're talking about dryness and how actually it can have such a profound effect on how you're feeling as a woman.
Definitely.
In yourself, your confidence.
Especially with libido. I mean, testosterone can flip the switch, but if it's dry there,
you ain't going anywhere.
No, exactly.
That engine ain't running.
No, it isn't. So you need to give it some TLC. There's some great products in the market. There's ones I would recommend are from the Yes product range.
Okay.
There's moisturizers as well as lubricants there. Try to find ones that have no irritants in them. And even if it's feeling dry on the outside, simple coconut oil.
Really?
Tesco, Sainsbury's.
What about, so the symptoms will be itching, pain.
It feels like you've got recurrent thrush when you probably haven't. You might have thrush, but get that tested. But if you're not, then it could be that as well. Just feeling very itchy, like you suddenly developed eczema. Why eczema? You've got no history of eczema.
Yeah.
It's because that.
So if one was to experience dryness down there, how would one treat it?
So there are many different products out there. There are creams and pessary tablets.